Welcome to Health Education 2. The code for this course is He20D2. My name is S. Dube and I'm going to be your presenter for this course. First of all, let's look at the course content. What is contained? What is it that you're going to be doing in this course, Health Education 2? So we've got an introduction to primary health care, communicable disease, basic information, communicable diseases, malaria, communicable diseases, tuberculosis, communicable diseases, cholera, harmful hazards such as alcohol, drugs, and tobacco, and its effects on health and wellness, behavioral and contextual factors contributing to the spread of HIV, contemporary negative sexual behavior patterns, promoting first aid knowledge for community-based organizations and schools, designing and conducting HIV prevention in health education programs, the role of print and electronic media in raising health awareness, promoting women's leadership in planning, implementing, and monitoring of HIV and AIDS program. Learning outcomes, what it is that we want to achieve or what we want to see our students becoming. Students to develop, meaning you as students must develop an overview of primary health care and most common communicable disease in Namibia. So primary health care is very, very important, and I must say that it's very important. We need to have a deep understanding, especially in the field of study you're embarking on, HIV/AIDS management. Students to have an in-depth knowledge on the behavioral and contextual factors influencing the spread of HIV in Namibia. There are currently about 10 key drivers of HIV in Namibia, and you should consult the National Strategic Framework. And this includes, among others, multiple sexual partnerships, generational sex, transactional sex, alcohol and substance abuse, poverty, early sexual debut, and many others. So you need to know these contextual issues. We want our students to develop knowledge on harmful effects of alcohol, drugs, and tobacco on health and wellness of individuals and its consequences for individuals, family, and adolescents. And that students should be able to really learn more about print and electronic media in health education. So Namibia is blessed in many ways. We have got free airwaves, there is radio, there is TV. So how can you as an HIV management graduate or student really use electronic media to make sure that HIV/AIDS agenda remains or continues going on? Students to understand the importance of first aid at community and school level. There's never been a time when we need first aid in our lives, and it is very important that even if you're an HIV/AIDS manager, you need to understand basic HIV training. It's I wouldn't say freely available, but it is available at a cost at the Namibia Red Cross Society. You need that skill. So I always say to students, while you are studying, make sure that you get yourself acquainted with NGOs in this country which are working with HIV in various issues. By volunteering at Namibia Red Cross Society, you can score a chance of actually receiving free training, which can make prospects of you getting employed or prospects of you becoming a good manager open for you. And also, there's never been a time whereby the women leadership is so important in our country as we advocate for gender equality. Hence, it is very important to appreciate the role of women leadership in monitoring and evaluating HIV programs. Just a bit about this module. I won't go much into detail. This module is very exciting, it's very interesting, and I'll encourage you that the moment you get your module, you literally read it through to get in-depth insights. This module is basically made for you as second-year students. HIV management. It examines communicable diseases in Namibia. It discusses and reviews behavioral and contextual factors driving HIV, like I said before. The harmful effects of alcohol, we know by now. Statistics proves or has shown that an average Namibian drinks about 10 liters of beer per week. And you must remember that everything we drink and eat has to be processed by the liver and the brain. And all these things have got a deadly effect on our bodies, on our minds, on our bodies, and also behavioral. It affects other people. And also, the module talks about electronic media. How do you engage, or how do you make use of electronic media to make sure that you champion the cause of HIV and AIDS in Namibia? And also issues of first aid, like I said earlier. Maybe just a brief introduction. What do we mean by primary care? There's a very interesting definition which is even there in your manuals. It says it's an essential healthcare based on practical. So primary healthcare is practical. Scientifically sound and socially acceptable methods and technology made universally accessible to individuals and family in the community through their participation, and at the cost that a community and a country can afford to maintain at every stage of the development in the spirit of self-determination. So you realize that the concept of primary health care, we are bringing healthcare services right at the doorsteps of the communities. If you study HIV further, you realize that one of the challenges people are facing in terms of adherence to medication, amongst others, is the distances between the healthcare facilities and where the people live. So it stresses the issue or the importance of primary health care towards really proactively looking at the holistic development of the community's health. Okay. And to get us going, like I said earlier, if you look at the focus of primary health care, basically it reflects and revolves on the economic, social, cultural, political characteristics of the country and its people. It tries to address the main health problems in the community, and I must say, I must underline community, because very, very important that we keep alive our primary health care facilities through prevention, promotion, curative, rehabilitative care programs. If you look at the concept of healthcare education, it's more about the whole element of prevention, because there's an old adage that prevention is better than cure, and it will always remain that way. It also includes education, so people need to be educated. So as a graduate of HIV and AIDS management, you must be able to train. So you must develop training skills or facilitation skills, because all this information that you learn, you must be able to take it out to the public. You must be able to share it with the communities. It involves all aspects, parties, and sectors at all levels in government and society. And also it requires and promotes community involvement, and focuses on ultimate health reliance and the communities it serves. So communities, there's a concept in development studies called participatory development. So primary health care engenders that element of the community being actively involved in participating around issues of their health, so that they can take responsibilities of their lives. It relies on well-trained health workers to work as team and respond to health needs of the community. It also requires government to formulate national policies, guidelines, and plans in a comprehensive manner as part of a primary health care approach. It strives to attain acceptable health levels by the year 2000. I think this has been a bit old, but I think it has been, we can say this is a continuous issue. We must make sure that health for all is indeed a dream that has been realized. So in order for us to get going, this module has got 4 assignments, and I'll quickly run through these assignments because this is a semester module and you are supposed as a student to write assignments. So the guidelines of assignments, the technical presentations are all very, very clearly denoted in the tutorials. So I'll encourage you, strongly encourage you to read your tutorials in detail. To have a clear understanding, you must reference accordingly. We use the APA style. So familiarize yourself with the APA reference guide. Currently, we are using the 6th version. So you must download a copy, print, and make sure that you read that APA referencing guide, because remember, you are supposed to cite your work in text, meaning in the body of your work, and also you need to generate a list of references. So assignment 1 says define primary health care according to the Ium-He declaration and describe your words. In your own words, your understanding, and elaborate the concept of primary health care and discuss the focus. So what it means here is someone who has done research methodology. I'm sure you guys have done research. First of all, you keywords. What is primary health care? Ium-He declaration. And in your own words, what can you say primary health care is? And obviously, what is the focus of primary health care? And this assignment carries 25 marks. So make sure that you read this question. My teacher, I always think about this thing even until now. They told me that first of all, you must read the question 3 times. And then from there, you can start to understand what exactly is required of you. The second assignment is discuss the principles and philosophy of primary health care and name and explain those different components. So again, you have to pick the key concept. Discuss principles of philosophy, name, explain those different components. So again, look through your work, read thoroughly, and also I always say to students, avoid reading single sources. There's a lot of literature on primary health care. So it's very imperative that you consult your librarian or you consult the internet, but please avoid Wikipedia because it's not a reliable source. You can consult journals, academic journals on primary health care. If you go to your librarian, they will show you a concept called EBSCO. They will show you how to search for information in order to make sure that your work is of high quality. The third assignment is discuss some of the most communicable diseases in Namibia and discuss malaria in full. That is diagnosis, prevention, treatment, and what is the status of the elimination of malaria. You must remember that Namibia belongs to a concept called elimination aid. And hence, in order for you to really get a good understanding about this topic, it's very important to visit Ministry of Health offices. And you can also visit the university because the Ministry of Health is working in collaboration with the Ministry of Health, especially the MRC. There's a division called MRC, Multidisciplinary Research Center at the University of Namibia. They will be able to direct you to some researchers who are working on malaria. You will get the latest information on how Namibia is working towards eliminating malaria as part of E8, like I said earlier. So this assignment is very practical, but before attempting, first of all, you must read, you must consult relevant people who are working in these divisions. They will give you the most fresh and reliable information. In the last assignment, it says you have been appointed as a community mobilizer in your region. discuss how you go about implementing the 90-90-90 concept according to Vision 2020 in the fight against HIV in Namibia. This assignment basically focuses on health education. It is about you as a graduate. You must be able to foresee what's going to come through for you. The 90-90 concept says that 90% of the people must be tested or diagnosed for HIV, 90% must be put on ARV treatment. For those who are tested must be put on treatment, and 90% of those who are put on treatment must achieve 90% of viral suppression. So we are talking about an ambitious target to scale down HIV and AIDS, and this has to do with educating your communities. How do you go about it? So again, if you look at, you must go on the internet, download the Vision 2020 or the 90-90 document. It's about a 40-page document. Read it thoroughly, gain a good understanding, and then you look at your health education chapters and see how you can build together or put together an exciting piece of work on how you can go and educate your community around that. And obviously, in conclusion, you can refer to your study manuals for more details, and kindly contact me. All my contact details are in your tutorials. And all I can say is enjoy your journey of self-discovery. I thank you.